So, it is cool to go out for a drink, right? With friends and family and occasions. But what's what is it when it becomes a problem? How do you know it's a problem? And how do you know that it's not having a negative effect on your prostate and your longevity? Alcohol, prostate, and longevity. Let's go. Welcome to the Dr. Geo podcast. I am your host, Dr. Geo, where it is my full intention to help you with your urological function and to live better with age. Today's topic, it's one that I've been meaning to talk about for a while now, and I think today's the day, which is on alcohol consumption and prostate health. Alcohol consumption and prostate health. I come from a family history where I know, my dad had an alcohol problem. All right, he was definitely an alcoholic, and at around the age of 60 or so, he stopped drinking, and that was a good thing for him. And I have other family members that had alcohol problems. So I have a particular respect for that chemical, right? Alcoholic beverages. I have respect for the bottle. So what I like to do is, I always want to talk from a reference of science, but you know how we do it here at the Dr. Geo podcast. We want to do it holistic, but we also want to do it realistic. So for me, a major part of my work is, as you know, if you've been listening to the podcast, is how to look at the science in a way that we can implement in day-to-day life, right? My intention is never to leave you high and dry. Oh, great information. And now you can sound smart at the next, family event or something. But that's not what I care to do. I want you to take action. Today's conversation on alcohol consumption is with that in mind. Let's start with the big picture. How does alcohol work in the body? So when you have a drink of whatever, how does alcohol work? To put it in simple terms, when you drink alcohol, two things happen. Number one, there are enzymes in your body that starts, and in the liver, that starts breaking down the alcohol, right? So it breaks it down so that your body can best metabolize it and actually use a little bit for energy. So much of the energy that you use that is from carbohydrates and proteins, you use a little bit of alcohol for energy, but your liver enzymes, there are liver enzymes that breaks alcohol down so that, it is a protective mechanism. The other thing that happens when you drink alcohol is that it suppresses a hormone called antidiuretic hormone, ADH. So when you suppress ADH, which, antidiuretic hormone, what it does is it inhibits you from urinating excessively. So it stops you, it holds water in. When you drink alcohol and you suppress ADH, then you have to pee more. To sort of keep it simple, those are the two main things that alcohol does. When you have a drink, you create more liver enzymes to break down the alcohol, and you suppress ADH, so you have to pee more. Then the way I want to take this conversation is the following. Big picture, right? The big picture is, all right, when I have a drink, should I be drinking? Does it help with my longevity? And of course, what are the effects of drinking alcohol as it relates to the prostate? And then the other one is there one type of alcoholic beverage that's actually better than the other? Big picture, alcohol and longevity. And the reason why this is important, of course, is because you know about the French paradox, right? The French paradox. How can these French people, how can the French live so long and they don't really have coronary or heart disease like we do in the US, but they drink tons of wine and their diet is not great, and they smoke more than we do? That doesn't make any sense, right? When you look at the research, and by the way, when you look at the research, that's yes, it's good. No, it's not good. It's back and forth. But it does seem to say that definitely those that drink too much that's a problem. And that increases mortality overall across the board with everything. Higher cardiovascular, higher cancer, so forth. Right? So drinking too much is a problem. We'll get into what's too much and quantities and things like that in a second. But drinking with moderation, a term that I really hate to use because your moderation and my definition of moderation and your friends and my friends' definition of moderation is different, right? So I like the term moderation in moderation, right? With moderation. What is the data saying? Well, from a mortality perspective, it's saying that men can tolerate a little bit more alcohol than women. So it seems to be more damaging in women than it is in men. So I think the recommendation is somewhere about a half a drink per a day for females, and about a half to a roughly a full drink serving for men, and that's definitely tolerable. However, when you look at this data, and some data is recommending good versus bad, you have to have a serious and honest look at yourself and say, well, do I have an alcohol problem? Right? And this is what I mean by holistic but realistic, right? Or, the science says this, but in real life, sometimes we have, other things that we're dealing with. But keep that in mind as you listen to the rest of this conversation as it relates to alcohol consumption. Keep that in mind. What is the possibility of me having an alcohol problem? How about alcohol and the prostate as it relates to the big three, right? Which are the big three? The big three are prostatitis, BPH, and prostate cancer. Does it help with any of these things? Let's start with prostate cancer. If I drink more alcohol, does that increase the risk of prostate cancer? The data, for the most part, and is the preponderance of information out there. So it's not just looking at that last scientific paper, looking at the conclusion. No, we're looking at a variety of papers. And I think the conclusion is that there is no direct link with alcohol consumption and prostate cancer. There is more of a direct link with alcohol consumption and other types of cancers, like esophageal or throat cancer. So yes, there is a link between more alcohol consumption and throat cancer. And if you drink alcohol and smoke cigarettes, that increases the risk significantly for throat cancer. So that combination seems to be worse than just alcohol, but just alcohol alone does increase the risk of throat cancer, not associated with prostate cancer. So then if I already have prostate cancer, does it increase the risk of a recurrence of it coming back? Unlikely. What type of alcoholic beverage is probably better for me to drink across the board, but certainly with prostate cancer? The data shows this very interestingly, and most of you think this is true, and it probably is. It seems to be that, red wine, it's better. Now, when you look at these studies, right, what they're doing is sending out questionnaires. So it's very hard to determine outcomes or causation from questionnaires that people fill out and then send back in, because you have to assume that they're being honest. So if they consume, 5 drinks a day, they may put 2 drinks a day. So you have to make the assumption that they're being honest. And 2, it's not a controlled environment. So actually, typically in the scientific world, when we cite data, they would say, well, animal studies, it doesn't matter. What happens in human studies? Actually, as it relates to alcohol consumption, I actually like animal studies probably more than humans, because it's a controlled scenario, right? It's a controlled situation. You're feeding the mouse, alcohol, and then another mouse, no alcohol, and then you're monitoring the health of that animal, of the mouse, for X amount of time. So actually, I like animal studies as it relates to alcohol consumption. What animal studies show as it relates to red wine is that it is more protective. And likely the reason for that is I still don't know that alcohol in it by itself has any benefits. If the only thing you have in your body to produce energy is alcohol, then it's going to use that for energy. Your body, your cells will make energy from alcohol if that's the only thing you have. So there is some benefit. Red wine has all sorts of chemicals that make the wine red, right? And much of that is resveratrol and other very important chemicals that we know are protective. If you're a non-drinker, I wouldn't say, hey, you need to start drinking right now. I mean, if you really want to protect yourself against prostate cancer, you have to start drinking now. I wouldn't say that. There's other methods of doing that, of course, and we talk about it all the time on the Dr. Geo podcast and drgeo.com. A lot of things written there, which I urge you to sign up because I send a lot of goods twice a week to that list. drgeo.com. Red wine. By observation. Okay. So I don't know that this has been studied, right? So this is realistic, real life. By observation. What happens when people drink red wine? I've never seen, and I know it happens, but I've never seen anybody, have a really tough day at work and, hate their home life and say, oh, I'm going to go to the bar and I'm going to have, some red wine. I've never seen that. Have you? Typically, in that scenario, you're going to have a couple of shots of whatever. Let me get a bourbon straight up. Let me get another one, right? Which that's not a good scenario and that's very unhealthy. People typically who drink red wine, is it a happy scenario, celebration, toast, it's a happy. So typically red wine drinkers are happier. I think it's a fine combination of perhaps the pigments in that red wine, the resveratrol and other important chemicals that are protective for sure. And I also think that typically when you drink red wine is in a happier environment. So red wine is the way to go. Let me say this. In fact, I had a patient this past week, right? Middle-aged man said to me, I'm drinking, and ever since the pandemic, I'm drinking about a bottle a day, and I don't know that that's good. The poison is in the dose, right? Another area that shows very clearly is, maybe some red wine, even daily, is fine. But when it's too much, then it's a problem, and it can induce problems and premature mortality. A bottle a day, in that scenario, you have an alcohol problem, or you might have. I don't know you. I don't know some of you. I know some of you, but I don't know all of you. You have an alcohol problem and you need to address that. Okay. So how much? About a glass a day is fine. Well, Dr. Geo, don't make up stories with what I say. Well, Dr. Geo said, I heard the podcast. He said, hold on. He said I should have a glass of red wine a day. So since I'm not drinking from Monday to Friday, I have 7 glasses on Saturday. That's not what I'm saying. All right. So be careful with how you interpret what I'm saying, particularly again, if there's an alcohol problem. What I am saying, however, is that if you're going to have a glass of red wine a night, that's fine. Have it with dinner. That's fine. There may be some protection there. If you're a non-drinker, you don't care to do so, you don't have to. There's many other ways of getting resveratrol and all these other benefits, including from actual grapes and berries. And, all berries have a significant amount of the same type of chemicals that red wine has. So not to worry. But this is just so that you can actually have a glass of wine guilt-free, right? Because, at the end of the day, guilt is way more indigestible than any food. So we don't want to live with guilt. We don't want to eat with guilt. And we don't want to drink anything with guilt. So how about red wine or alcohol as it relates to BPH? There again, so here's the deal with BPH. And I think that you guys really need to listen up because, again, I don't want you to create your own stories. BPH is, by definition, an enlarged prostate, a prostate that's too big. So when you look at some data, and actually written on this in some scientific journals and books, if you look at the data, actually the data will indicate or suggest that, hey, you know what, you can have any alcohol. You can have about 1 serving of any alcoholic beverage a day, whether it's a beer, a drink of whatever, whiskey, tequila, or red wine, no problems a day. And that might help with BPH and enlarged prostate. That information is not good enough for me, because what you care about is not whether or not your prostate is enlarged. What you care about is my enlarged prostate causing me to have urinary problems? So you only care to the extent that you're getting or you're experiencing urinary problems. You know how many prostates I've seen that are pretty big and the patient has no urinary problems? Quite a few. I've seen many prostates that are small and there's plenty of urinary problems. Remember, as it relates to BPH and enlarged prostate, doesn't matter how big your prostate is, with some exceptions to that rule, because if your prostate is too big, then it starts pushing up against other nerves and tissue and causes, even it could even cause some erectile dysfunction, because the nerves that push up, there's a few nerves coming from both sides of the prostate where that innervates the penis and it serves for erections. If the prostate gets too big, then it could push up on those nerves and stop the nerve function that goes to the penis, and then some erectile dysfunction may occur. But that's in extreme cases. That's probably unlikely to be most of you. If the problem is I'm urinating a lot, then what's one of the functions of alcohol in the body? It stops the production of this hormone that stops you from urinating. If you suppress that hormone, ADH, then you're going to urinate more. That's why when you have a drink, you're running to the bathroom. I would say that alcohol consumption for BPH, for an enlarged prostate, it's only a problem if there's urinary problems involved. All right. How about prostatitis? I read somewhere that alcohol can be irritating to the prostate and induce prostatitis. Not the case. Not the case. Unless, of course, because with prostatitis, what's the experience? The experience is of the patient, of course, the experience is, local pelvic pain, discomfort, and combined with urinary problems. That's sort of the definition of prostatitis, right? So prostatitis is an inflammation of the prostate that causes pain, discomfort around what's called the perineal area. That's the area between the scrotum and the anus, around the testicles, around the whole pelvic area, and in conjunction with urinary problems. If there's urinary problems, there again, alcohol will have you go urinate more. Can alcohol induce more inflammation to the prostate? I don't know that to be true, but it's possible, right? It could be pro-inflammatory in excess. All in all, alcohol consumption may not be bad for the prostate, but red wine is better. I always tell my patients, look, if you have to choose one, let it be red wine. And I know, of course, hot summer day, barbecue, who wants to drink red wine in that scenario? You want a glass of either cold white wine or a beer. No problem. The poison is in the dose, right? So ultimately, if you have one or even two, you're fine. You go beyond two, then there might be problems. What I've seen in my practice, and after really seeing thousands of really amazing men, I'm really fortunate to do the work I do. I can't believe that I make a living from what I do sometimes. What I've seen is that alcohol has is causing hidden problems in people, because a lot of people, particularly post-pandemic, are drinking way too much. We won't talk about COVID or anything like that. Certainly, we won't talk about politics. But the only thing that was open is really hilarious. The only thing that was open during the pandemic shutdown, right? Complete shutdown. Well, liquor stores. Liquor stores, and they delivered to your house. You didn't even have to leave your house. And by the way, the AA groups were closed. And they didn't even have Zoom meetings until later on. The organizations actually help with alcoholics. They were closed, but the liquor store, they were open. Weird. In any event, I think that the pandemic perpetuated the problem. But I think, like most things from the pandemic, if there's already a problem prior to the pandemic, it just put it in the forefront. I don't think that people who were either non-alcoholics or non-drinkers had all of a sudden became alcoholics or had a drinking problem. So if you had already a not so great relationship with your family, then when you're stuck with them for months at a time, that was more of a problem. If your business was not too good right from the beginning, then your business suffered. If you had a decent business, then your business probably survived and even thrived with PPE and all these things. Same thing with alcohol consumption. Okay, so what the pandemic, I think, did for a lot of us is figure out, all right, where are there problems and let's fix it. Alcohol overconsumption is a problem, and people think, well, oh no, I'm not Larry. I know my friend Larry. He wakes up, he needs a drink to function. That's not me. There's a full spectrum of alcoholism. There's a full spectrum. One is those people that actually cannot function and they sort of get the jitters and they don't do well from eliminating alcohol. And there's another group of that, they need it to cope with day-to-day problems. And you can see, so how would you know? Dr. Gio, how would I know if I have a problem? All right. That's a fair question because I'm a functional, alcoholic and things like that. Okay. You have a problem. There's numerous ways, and I wouldn't consider myself the expert in the area. There are many great books out there, and Alcoholics Anonymous is a fabulous organization. So I think that if you have any inhibitions and you think you should go to somewhere, I think you should try AA because it's one of the most fascinating organizations that I know. And they truly help people. And you should not be feeling vulnerable of going and dealing with that. Just, face your fears and make it happen if you think you have an alcohol problem. How would you know? And this is also part of what I observed with friends and family, by the way. Part of it is the way you drink. You shouldn't need a drink. You should want a drink. If you think you need a drink, that's a problem. If you think you need a drink often, that's a problem. Now, I know that it's not always, so you want to just take the edge off a little bit and you have a glass of wine. That's not a problem. But I need a drink so that I can feel better. I can calm my nerves every time. That's a problem. I need a drink to be more social. That may be a problem. Now, one drink in a social environment, if you think you suffer from social anxiety and maybe, you're trying to hook up with, a gal or another partner, whatever. Yeah, it works, right? Because you kind of loosen up a little bit, right? But to have to need one after another, or just shots after shot, that's a problem. Here's another thing you need to know. If the party is over and most people, stop drinking and you keep going, that's a problem, right? If you don't stop until that bottle is empty, that's a problem. If your wife thinks you have a problem, you have a problem. If you have said, I may have an alcohol problem, that likely means that you do. No one that doesn't have an alcohol problem would ever say, I may have an alcohol problem. And just switching from hard liquor and spirits to red wine after I just said, well, Dr. Gio said red wine is good. No, it's the alcohol. The other thing with alcohol, so that's how you determine if you have a problem. Again, there's good resources out there. The other thing with alcohol is that it interferes with good sleep. You get up to urinate more. And even if you don't get up to urinate more, you never have good sleep. Yes, it helps you go to sleep. It helps you get to sleep, but the quality of your sleep is not good. And so even if you sleep 8 hours, the quality is not good and you kind of still wake up groggy. I don't know about you. I want to be optimal. I want to be in my optimal health as often as possible. And I've noticed in my own, and by the way, I do have a drink every now and then, of course. But I noticed that, I tolerate it a little bit less as I get older. So even if I have one drink, sometimes I wake up with this little mild headache and I hate that. So I'd rather not drink most of the times. That's being holistic, but realistic as it relates to alcohol. A little bit might be good. If you don't really have a problem, if you have a problem that needs to be dealt with, and then you need to stop drinking, at least for 90 days, if not more. AA is a great organization that you should consider. If you already have urinary problems, it's going to get worse. I know people that are drinking and they're on diuretics, right, for blood pressure. So these are pills that help you pee more so that you lower your blood. So they're drinking and on diuretic, and they're wondering why they're peeing all the time. And they're also older with probably enlarged prostate. Be careful when you combine alcohol with other meds. And all things being equal, moderation in moderation, which means, by the way, one last moderation. Moderation is different for everyone. If you're a heavy drinker, then you don't start feeling good until your third or fourth or fifth or sixth drink. If you're not a drinker, so if you're a 95-year-old, 80-year-old, 90-pound, 80-year-old woman, then you can have a half a drink, and that might be a lot. That might be moderation. This is why, by the way, if you, back in college, right, we used, not me, because I was really never, I just didn't care for it. But people used to boast, I'll drink you. I'll drink you under the table, right? I will drink you right. No problem. You're a college kid. Your frontal lobe of your brain is not fully developed. Okay. When I hear these things with older adults, what are you doing? What are you doing? What are you doing? Right? If you can outdrink anybody, that's a problem. That means that your body is naturally making more enzymes to break down alcohol. And now in order for you to feel cool and relaxed, you need more drinks. That's a problem. So moderation really depends on how often you drink. If moderation for you could be a 6-pack a day. I had a patient actually that this is a true story. The patient, right? So Dr. Gio, this is their follow-up visit. I heard what you said last time and I'm drinking in moderation. Oh, that's great. So, how often are you drinking? He's like, I drink every day, but now I only drink a 6-pack, not 2. So, and he was serious. He's like, no, I only drink 6 beers a day, 6 cans of beers a day. So that's moderation for him. So moderation depends on how much alcohol you consume. And really, it's not more than 1 serving of any drink a day. Red wine is likely best if you must. This is Dr. Gio signing off. I'll talk to you next time.